Hello, Dr. Uswiki here, and welcome to today's lesson. In today's lesson, I'll be sharing tips and strategies to help support our elementary learners and children with ADHD. What is ADHD? ADHD is defined as attention deficit hyperactivity disorder. ADHD is a neurodevelopmental disorder found in children, teens, and adults. Its core symptoms are inattention, impulsivity, and hyperactivity. In our elementary learners, these symptoms manifest in the form of making careless mistakes while lacking attention to details, inability to pay attention or sustain attention for extended periods, being easily distracted, especially by moving objects and even unrelated thoughts, fidgeting with hands, feet, including squirming in seat, getting up and leaving seat, especially when seating is expected, constantly on the go, talking excessively, moving excessively, pacing, and having difficulties waiting for his or her turn, leading to talking out of turn, interrupting a speaker, and consistently butting into games, activities, and conversations. Again, it is important to remember that ADHD does not look the same on every child, and symptoms may vary from one elementary learner to another. I'll be sharing tips to help and support our elementary learner with ADHD. Tip number 1. Seat our elementary learner with ADHD away from doors, windows, or busy areas with multiple objects that can easily distract them. Tip number 2. Use visuals, images, pictures, and color coding, especially to support directions, instructions, and assignments. Tip number 3. Work on the most difficult aspect of curriculum or most challenging activities that our elementary learner with ADHD finds challenging early in the day, as they'll be better equipped to maintain and sustain their attention to task early on in the day as opposed to much later in the day. Tip number 4. Give instructions and directives one step at a time, and repeating these steps and directives over and over as necessary and as needed. Tip number 6. Give frequent breaks to our elementary learner with ADHD throughout the day. These breaks can be in form of a physical break where they take a walk, do a movement, stretch, or just a mental break or pause from tasks and activities. These breaks can also range from a few seconds all the way to a half hour. Tip number 7. Splitting up projects, tasks, and assignments into sections and segments. A great supportive strategy is to break tasks and assignments up into chunks and assign a completion goal or target for each section or for every chunk and section of the assignment. Tip number 8. Providing additional and extended time to complete tasks and assignments. It is necessary that ample time is provided to our elementary learner with ADHD to include time for breaks, time for pauses, and just to provide them the additional time that they require, especially they will have to be redirected and refocused to the task or assignment. Again, these tips and strategies are best implemented in collaboration with the goals outlined by the caregivers of our elementary learner with ADHD as outlined and aligned to their IEP. To help us, I have created a list of these tips and strategies please visit my website to download a free copy of these tips. Thank you for learning with Dr. Sweke today. See you in the next lesson.